And the US CDC is making a national forecast predicting 7,600 to 23,700 new COVID-19 deaths, which it says will likely be reported during the week ending February 26, 2022. Well, let's find out more. Joining us right now, Dr. Adekunle Tometi, a clinical pharmacist. He joins us from Dallas, Texas. Thank you for joining us on the program.
Thank you very much.
We hear infections are coming down. We're seeing that in the United States. But what about the deaths?
Well, thank you very much for the opportunity. The death rate that we've seen, it's coming down, as well as hospitalizations have been coming down. When we look at when we were last on this program, which was January the 20th, we were looking at a high occupancy rate in the hospitals where all the beds were filled up. But for now, we're seeing people being discharged. We've passed the Omicron peak. We are no longer at that place where we have no beds for people. In fact, in places like New York, infections rate in the community has dropped 90%. Same thing with a place like where I am here in Dallas, Texas. Infections rate has dropped about 75%. So as more people are leaving the hospital, we're having less death. Also, we're seeing that the Omicron variant itself is not causing as much death as the previous Alpha and Delta variants, because what we'll find out with research is that the Omicron virus only affects the upper respiratory tract infection and not the lungs. So since it doesn't affect the lungs, deep down, people are able to manage this Omicron variant. They're less sick, and we have therapeutics to help take care of this. So because of this, we're seeing a whole lot less death amongst the populace.
But even with that, the World Health Organization is saying it's premature for really any country to declare victory, saying it's still dangerous, and it continues to evolve, and it's monitoring even some sublineage of the Omicron variant.
Yeah, that is true. It's not time for anybody to declare victory. But when we go back to our basic immunology, there's something we call secondary immune response. A majority of the population have had their vaccines. I'll say in the state of Texas, for instance, we've seen 70% of people have gotten their first shot. 60% of the people have gotten their second shot. That's an increase from the last time we were here, where it was 60 and 50. And in the US, as a country, we're looking at 75% first shot, 60% second shot. Because a lot of people have gotten their shots and they've gotten boosters as well. They are protected somehow against these COVID-19. What I was alluding to earlier about secondary immune response is most people have had a bout of Omicron or a bout of the COVID-19 infection. Somehow they have antibodies within them. A lot of people have had their vaccines. Those who believe in science, they also have some antibodies in them. So if there's another wave that's coming right now about any new variant of COVID, it is assumed that a lot of people, most of the population now have antibodies against the virus. But still, we will not stop from asking people to continue to follow public health advice, continue to, if they can, wear their mask, stay 6 feet away from people, wash their hands, and assure that they don't gather too much in crowds.
But Dr. Tometi, if that assumption is correct with the antibodies that have developed, I mean, that's part of the arguments for the anti-vaxxers, saying that there doesn't need to be a vaccine mandate.
I would not say that there should be or there shouldn't be a vaccine mandate. After all, when you buy your car, you drive your car, nobody asks you to get insurance. You must get insurance. Somehow it is important that we encourage people that there are opportunities and avenues for them to get their vaccines. It's a beautiful thing here in the United States that vaccines are free, and the government has stopped a lot of outlets for people to get their vaccines. Pharmacies are everywhere, within 1-2 miles to people's homes, people's work, so they can always go there and get their vaccines. If they choose not to get a vaccine, over here people have a lot of rights, so we cannot force people to get vaccines. Well, vaccines have been shown to be one of the very important way and method of trying to control and win this battle against COVID-19.
We appreciate your time on the program. Thank you so much, clinical pharmacist Dr. Adekunle Temesi, joining us from Texas. Thank you for joining us on the program.
Thank you, Ms. Millicent. Bye-bye.